歡迎大家出席今日嘅
Welcome to today's press briefing. We have two doctors with us today. Dr. Zhang Shuquan, Head of Communicable Disease Branch, Center for Health Protection, and Dr. Sarah Ho, Chief Manager of Hospital Authority. They will give you an update on HA situation and COVID cases. We give the floor to Dr. Ho. Good afternoon. We have 2,760 patients in our facility. 322 are newly confirmed cases. For those requiring isolation facilities, 479 patients are in isolation wards, 193 patients in second-tier wards, and 496 patients in Hong Kong North Lantau Hospital Infection Control Center. 217 patients are in Treatment Center for COVID in Asia World Expo, and 204 of whom are new cases. We reported 7 more patients yesterday in critical condition and 9 more patients in serious condition. Among the confirmed cases in our facility, we have 51 in critical condition and 57 in serious condition. 14 patients in critical condition are receiving intensive care. We also reported 15 more death cases, comprising 10 males, 5 females, age 50 to 102. 9 of the deceased did not complete the 3-dose vaccination regime. I'd like to highlight one case involving a younger patient. It's a 50-year-old male patient. On the 14th of September, because of stomach pain, this patient visited A&E unit of Port Oi Hospital. On arrival at the A&E unit, the patient's blood pressure was found to be low, and we then proceeded to resuscitation, and we also conducted a rapid antigen test. The result was negative. Because of the urgent situation, the patient was referred to intensive care unit of Tuen Mun Hospital the same day for further treatment. The patient's condition continued to deteriorate, and in his blood sample, we found bacteria, and unfortunately, the patient then passed away. And whilst in hospital, 2 PCR tests were conducted on the patient. Negative results were returned. And according to record, on the 28th of August, the patient also did an RAT with a positive result. So according to our statistical definition, we are reporting this case today. Another patient was a 4-year-old boy. On the 13th of September, this boy tested positive for COVID, and on the 15th of September, because of shortness of breath, he was admitted to A&E unit of Tin Shui Wai Hospital for treatment. On the same day, he was transferred to the isolation ward in Tuen Mun Hospital. And then this morning, the boy's condition suddenly deteriorated. Despite resuscitation, he passed away. This boy had chronic illnesses, and he required intubation for feeding. And he had fever, coughs, and shortness of breath as onset of symptoms. The boy also had 2 jabs, respectively in April and May, of Sinovac vaccines, and the case has been referred to the Coroner's Court for further investigation. 360 patients have recovered as of yesterday, including 333 who have been discharged. 6 patients test positive via hospital admission screening, and 16 patients sharing the same wards will be listed as close contacts. As for HA staff members, we have recorded 114 more coming down with COVID, and 66 other staff members have returned to their positions. Dr. Zhang. As of yesterday, we recorded 8,868 local infections, including 2,185 PCR positive cases and also 6,683 RAT positive cases. There are also 131 imported cases, including 125 PCR positive and 6 RAT positive cases. Among the 131 imported cases, 62 were picked up at the airport. and 29 picked up at quarantine hotels or quarantine centers. As for the remaining 37 cases, they belong to specimens collected on the 4th and the 7th day, and also 3 more cases for specimens collected on the 8th and 10th day. They come from 36 countries, and 4 countries imported more than 10 cases, including UK 23, Thailand 18, US 10 cases, and the Philippines 12 cases. As for the remaining places, they have imported fewer than 10 cases. As mentioned by Dr. Ho, the HA today reported 15 death cases to us, and the forensic pathologist also reported 1 case to us, and that's an 85-year-old male patient. He lived with his family. He required constant care, and he had chronic illnesses such as DM and hypertension. On the 6th of September, he had some coughs and a dry throat, so he stayed home. He did not have contact with any COVID patients. On the 10th of September, he did a test at the community testing center and then received a positive report on the 11th. And then on the same day, he was found to have passed away at home. The case was sent to the forensic pathologist. And according to the pathologist's observation, his death is related to COVID. As for care homes, 3 residential care homes for the elderly have recorded 3 confirmed cases involving residents and Chong Park in Yau Chim Mong and Yuen Long Chang Ching, and then in another district, Tien Ting, home for the elderly. As for schools, today is Friday. We have 656 schools reporting 1,014 positive cases to us, affecting 885 students and 129 teaching staff. And for the 1,014 cases, they've come from 151 kindergartens and childcare centers, 268 primary schools, 222 secondary schools, and 15 special schools. "450 schools reported more than 2 cases to us in the past 7 days, and we have advised 13 classes from 12 schools to be suspended for 1 week. That means 1 school will have 2 classes suspended for a week. Previously, we mentioned some schools subject to class suspension, and for 2 of these schools, another class will have to be suspended. One is HKFEW Wong Chau Bill Secondary School. Last time is class 5B, now is 6B, now is 5B. Next, Sengdo Galan College. Faith class was suspended. Now S1 Honesty, in which 4 out of 31 students have been infected, and this class will be suspended. As for subvariants, the percentage of L452 are further edged upwards, and for the specimens taken on the 13th, the percentage of L452R now stands at 84%. For BA.5, it's about 74.3%, BA.4, 9.7%, BA.2.2, 12.6%, BA.2.12.1, about 3.4%. That concludes my report today. The floor is open. Please introduce the media organization you represent before you speak. Questions? At the back row on the right-hand side. I'm from Now TV. First, about the boy passing away in Tuen Mun Hospital. What is the reason for his case to become critical? Was his death related to COVID or not? According to his family members, there is a question whether it's a medical incident. What is your view? And also for healthcare staff, did they know that this boy had difficulty in eating? And then Dr. Leung Pak Yin said that somebody is holding back the path to normalcy. What is the CHP's view? And for Hong Kong, U indicator is now dropped below 1. Does it mean that the epidemic has peaked? And according to some experts, the epidemic is coming to an end. Do you agree? Is there room to relax the social distancing measures?
The R number at HKU reflects, like over the past week, the pandemic situation. The numbers have seemed to be stable or on the downward trend is less than 1. But today's number rose a bit again in terms of caseload, more than 8,600. So it might have to do with the Mid-Autumn Festival. So we need to wait for a few days to see whether the number of caseloads continue to drop or what, or whether there's an obvious downward trend or not. But we need to monitor the situation in the coming few days. In the past few weeks, the government has all along been monitoring the trend and has come up with some adjustments in precautionary measures. For example, it has already scrapped the suspension mechanism and also introduced the 3+4 quarantine measure. I'm sure the government will make further adjustments when needed. As for the boy, in the morning, his condition deteriorated. After making last-ditch efforts, the boy still passed away because his situation deteriorated very quickly. So we will refer this case to the coroner's court to take up a follow-up investigation to find out the reason behind. Next one, on the left, in the front row. I'm from Cable TV. I want to ask about under the 5th wave, the death rate actually has been based on the situation since the pandemic occurred. But in the latest row, in the early stage, oral medicine was not available. And also, do you think that we should actually look at the death rate on the basis of different periods so as to come to a fairer analysis? And also, the Health Bureau said in the blog yesterday that the mask can be a good protection against flu, but not COVID-19. So do you think that it's time now for us to remove the requirement for people to wear masks? I don't quite get your second question. What is your second question in relation to masks? Because there is a blog written by the Health Bureau that says that masks can help us prevent against getting flu, but not COVID-19. It's written that in the past 2 years. What's your question? In the past 2 years, the mask could help prevent against flu, but not COVID-19. So do you think that the mask can have little preventive effect? Do you think we should remove the order for people to wear masks? Actually, all along, the death rate actually was classified into various categories, like for those who have received vaccination, and also it has a breakdown on the basis of age groups. Under the 5th wave, in this latest wave, and since May, the death rate actually can be considered to be lower. But that's largely due to the fact that we have implemented a number of measures. And also vaccination rate has gone up. And the hospital authority has been distributing the oral medicine to high-risk groups. And the death rate, normally, as you can see, for people with vaccination, for the whole 5th wave, for people fully vaccinated, even though the overall death rate is 0.6%, if they have received 3 doses, then the death rate is 0.04%. But of course, the situation varies depending on the age groups. For those aged above 80, the death rate is quite high at 8.4%. But if you have got 3 doses, it will drop to 1.12%. But if you have not receive any vaccination at all is as high as 14.something%. The death rate recently, well, since May, then is around 0.1%. And that's mainly because most people have received doses of vaccine. And also a number of treatment measures were also adopted. So it doesn't really make much difference with where you draw the line. Since May, from May till now, of the 460 plus deaths, more than 320 are people aged above 80, making up 70% of the total. At this moment, people aged above 80 and small children have not yet received even one dose of the vaccine. I can give you a figure. Like by yesterday, people aged from 5 to 10, 64,000 people have not received any dose, 60% of the age group, and 6 months to 4 years old, 90,500 people, or 49% of the age group have not received any dose at all. For those aged 80 or above, figures on September 12th show that 116,000 people have not received any vaccination. That makes up 29% of the age group. So for these people who are unvaccinated, at this moment, should they become infected with Omicron, they have a high risk of developing severe diseases or even death. So I hope that the high-risk groups, the old and the very young, would receive vaccine. As for the wearing of masks, masks can effectively prevent someone from getting flu, and we haven't seen many cases of flu in the past few years. That's because of the wearing of masks. But masks alone cannot prevent COVID. But still, masks are effective. Whether you wear them or not, it makes a difference, but just wearing masks alone cannot prevent against COVID. Lady at the back, I'm from Mingpao. Tin Mun Hospital case, the 4-year-old boy, you said that he has some chronic diseases. What sort of diseases did he have? And he was at the Tin Mun Hospital. How was the situation like when he was admitted? And there are reports that there's no CCTV, which is working in his ward. Is that report correct? Why did that happen? And also for today's death cases, how many of them were directly related to COVID and how many were not? Under the fifth wave, your analysis of the death case, what is the proportion of cases die with and die of COVID? And also to ask about CHP. Well, there are lots of conditions required for the relaxation of social distancing measures, but what are those requirements or conditions? Can you, do you think that now is the time to relax the social distancing measures with a drop in the reproductive number that is now below 1? All along, we've been looking at a host of factors. It's a condition of severe cases resulting in death. We also need to consider the ability, the capacity at hospital authority, the hospitals run by the authority, and vaccination rate, whether we have adequate treatment facilities, and so forth. And mainly, we are worried about whether our medical facilities, services would be heavily strained and undermined, and also whether there would be an uptick in the number of severe cases and deaths. As for the small boy, he got a problem with his muscle strength, and he relied on care by others for a long time, and he needed hospital treatment. That's why he was transferred from Tin Shui Wai to Tin Mun Hospital. And this morning, his condition suddenly turned bad, and we had tried our best. And this boy, his case, we will refer it to the coroner's court for follow-up investigation, and we hope to find out the exact cause of his death. Number of death cases, the breakdown. We need to look at all the cases one by one. And the fifth wave, we're still carrying out our investigation, and they're being looked at by our experts panel. If there are no other questions, this is the end of today's briefing.